The need for adequate mental health response in rural areas is growing at an astounding rate.
County officials say last year, Dane County Sheriff's Office officials responded to 1,400 calls with a mental health component. But as Armand Rahman finds, there are very different ideas on how to build a response system here. Armand?
That's right. County Executive Joe Parisi and Sheriff Calvin Barrett sent a memo today blasting the Health and Human Needs Committee for amending their budget proposal. Both sides want to address responding to emergency mental health in rural areas, but are at odds about how to invest in doing it.
We've got a solution to a real challenge that exists right now.
But Dane County Executive Joe Parisi's solution didn't garner support from the Health and Human Needs Committee.
This is about building a model where we don't have people with guns and uniforms showing up to behavioral health crises.
Parisi proposed $440,000 of his next budget go to civilian mental health professionals at each Dane County precinct.
And so when a call comes into 911 that now would likely be responded to by law enforcement, if it is deemed appropriate, we would be able to send out a civilian mental health care provider in a civilian vehicle.
The committee's idea, reallocating $250,000 to the City of Madison's CARES Crisis Response Team and help that model expand countywide.
It could mean, the county sharing more of the mental health worker cost share and having the city of Madison, take on more of the paramedic.
When 80% of the calls DCSO answers are mental health related, Parisi and Sheriff Calvin Barrett say there's no time to focus on a Madison-based system.
That's a study that's going to take a year or 2, 3 years to implement. So in the meantime, don't deprive people outside of Madison of critical mental health services.
According to the sheriff, the proposal would add to the 3 crisis workers already employed.
Right now, we currently send a deputy along with these part-time mental or embedded crisis workers. And once the scene is stabilized, the deputy takes a step back and the embedded crisis worker takes over.
And Sheriff Barrett says with time, the team will grow to mirror CARES for all parts of Dane County.
And that's for us to have a trained mental health professional to respond to these calls instead of a law enforcement.
And the ball is now in the court of the County Finance Committee to decide whether or not to approve the reallocation to CARES.